Hello, my name is Gabel Ochte, and I'm the Sales Director Eye Healthcare in Europe for Advantech. Before I begin, I want to thank you for taking the time to watch this presentation, which underlines the incredibly strong and close relationship that Advantech has had with Nvidia over many years. During this session, I want to inform you on the partnership between Advantech and Nvidia, give you a short introduction on Advantech Eye Healthcare and the market trends we see. Later in this presentation, my colleague from Advantech USA, Michael Johnson, will talk about Advantech's product solutions and user cases. As well as empowering the latest Nvidia graphic cards, Advantech works hand in hand in a partnership with Nvidia to satisfy the demands of the rapidly expanding market in innovative medical sector solutions. Recent times have emphasized just how important it is that hospitals operate at the maximum efficiency levels and patients have the best possible experience when they put their health into the hands of hard-pressed but dedicated medical professionals. Here at Advantech, we do not underestimate the life-changing impacts that the technologically advanced equipment can have on patients, and we are committed to playing a vital role in developing products that can make a real difference. We look beyond the humble graphic card to focus more on how entire systems can be catalysts for positive change. So who's Advantech? We are a leading player in the global healthcare market. Advantech Eye Healthcare has collaborated with many major international medical equipment manufacturers and system integrators to enable hospitals to deliver the most advanced patient-centered healthcare possible. As well as creating high-performance medical-grade products, Advantech Eye Healthcare continues to develop a range of intelligent and integrated platforms and services that are specifically aimed at mission-critical healthcare applications. For example, healthcare workers often use our tablets and all-in-one computers as mobile workstations, which provide crucial support by putting mobile data access in their hands. Mobility is the future in the medical sector, and our products help to provide medical professionals who are working remotely with the sharpest possible graphic images. Transportation of high-resolution video images over a long distance without compression is absolutely essential if the best possible outcomes are to be achieved. We offer solutions with our partners for the digital operating room. Our PACS and AVA solutions enable 4K UHD surgical monitors with integrated ND coders. Videos from operating tools are streamed with no latency or lossless image quality to any surgical display. This offers the capability of switching those video sources seamlessly. Another example is automated medication dispensing with AMIs, where a single compartment will open after scanning a patient's wristband, and all the data is immediately uploaded into the patient electronic health record. So no need for paper documents. Or what about an integrated solution that can both deliver entertainment to the patient during their stay and store patient information for medical staff at the same time? This is realized in hospitals via bedside terminals, the HIT. Before we go any further, here's a short video that explains exactly what Advantech Eye Healthcare does, how we do it, and why. I hope the video was helpful. To put this into context, it is important to look at how Advantech sees the future of healthcare and what role we can play in continually pushing the boundaries to develop solutions that are effective, flexible, and affordable. Working in isolation and developing products that are not designed with real-world applications in mind is just not good enough. Any serious player in this market has to work seamlessly with OEMs, equipment designers, and end users if they are to design the best possible solution. I've already mentioned mobile or remote medical care and treatment. But another major factor in the development of advanced equipment for deliver better hospital and patient experiences is artificial intelligence. With AI, medical professionals have been able to achieve outcomes that simply would not have been possible before. And there is much more to come. AI is speeding up the development of innovative solutions and techniques in an already rapidly changing world. AI is supporting operations, and there are multiple applications where this is happening through our machines and through Nvidia. At the bottom end, AI is already helping to cut costs and improve efficiencies by eliminating paperwork, speeding up diagnosis, and improving the ability of medical professionals to do their job. In some cases, AI even saves lives. Medical staff are still human beings, and if they have to look through hundreds of thousands of radiology images every day, there is always the risk that they could miss some crucial information to a patient's diagnosis. Of course, these people are highly qualified and experienced medical practitioners in their own right, but we can remove any chance of human error. We will go a long way towards enhancing the patient's experience and improving their health outcomes. That's why iHealthcare and AI are welcomed around the world by medical professionals who are committed to providing the best possible level of care. In a hospital that features iHealthcare, patients can be seen faster by specialists who already have the medical information at their fingertips. Whether it's blood pressure, blood oxygen levels, or even BMI, data is never duplicated or repeated, taking away unnecessary and time-consuming functions that patients would otherwise go through. The patient journey in a hospital setting becomes far more efficient and the patient's experience is enhanced. The situation is further improved by such products as medical cards, which help to increase the mobile productivity of nurses and other medical staff. The cards are fitted with a medication dispensing cabinet, which contains medicines for specific patients and the intelligence built into such systems. With a Wi-Fi connection and barcodes on the compartments that match those on a patient's wristband, ensures patients receive the correct medication in the correct doses. This is crucial, of course, and in an increasing busy, stretched, and complex environment, accuracy and reliability are more vital than ever. These improvements would certainly be worth celebrating in isolation. But multiply the time and the cost savings by the hundreds or thousands of patients that come through hospital or clinic doors every day, and the benefits really begin to stack up. According to a report from Signify Research, the world market for machine learning in medical imaging is set for a period of robust growth and is forecast to top $2 billion by 2023. We've established the need for the sharpest possible medical images and the benefits that they can bring. But let's take a look at some examples of how Advantech and Nvidia have worked together to expand the use of high-definition graphics and rapid processing technology in the medical sector. For confidentiality reasons, we are unable to identify end-user customers, but their applications are undoubtedly worth investigating. In one example, Advantech partnered with a leading AI imaging company to provide a life-saving healthcare solution. The company has played a key role in the European Imaging COVID-19 AI project, which uses CT scans to deliver automated diagnosis of the virus. Through a combination of camera imaging processing and intelligent video processing software, our solution was able to assist surgeons to deliver accurate diagnosis of tissue abnormalities. While some element of image processing can be already achieved by using standard computer-based graphic chips, our products were able to ensure surgeons have access to the highest possible degree of color and brightness on their monitors. The company we worked with specializes in applying AI and advanced computational models to radiological images so that abnormalities can be identified and measured. An advanced piece of equipment that has been supplied to more than 70 hospitals around the world is able to detect 14 different diseases that might affect a patient's chest, including emphysema, fibrosis, pneumonia, and COVID-19. Not only did the equipment prove capable of detecting the various conditions and give radiologists the information they needed to decide on what further investigations to make, but it also flagged up when the disease ceased to represent a significant risk for the patient. Advantech Eye Healthcare partnered with the company to deliver high-performance hardware, software integration, customer-specific design services, embedded systems, automation products, and global logistics support. The customer said that working with Advantech enabled it to put all its effort into software development, and I quote, "without having to worry about the rest." Now, in this case, the organization had developed a strong reputation for excellence among its customers, and maintaining that status was a key factor in choosing Advantech as a partner on this project. The CEO of the company said, and I quote, "End user characterize us by the machines we deploy, so they have to be the best quality. We can't put our software into just any hardware, so we chose Advantech, because the high quality of their products and the services are an excellent match for us." However, the success of this project was not just down to the quality of our hardware and the integration services that we provided. Our after-sales services, distribution and support are proving to be crucial in ensuring the success of our customers as it moves from being a software developer to becoming a smart solution provider. With Advantech's support, the company has been able to play a vital role in the fight against COVID-19 and a wide range of other serious diseases. In another application, Advantech's technology has been used to enhance image analysis via AI to help the medical professional or surgeon to locate and identify cancers in a patient. In an operating theater, clarity and precision are essential, and standard cards are simply not capable of delivering the quality that's needed. Advantech uses the latest Nvidia graphic cards to support medical AI developers, surgical navigation, picture archive and communication systems AI, known as PACS, and endoscopy AI. These are all applications in the medical sector where powerful hardware is needed, and the graphic card is an absolutely essential part of that. Now it's time to go into the subject deeper with cases done with customers and have a closer look at the Advantech Eye Healthcare products with Nvidia architecture inside. For this, I would like to introduce my colleague from Advantech USA, Michael Johnson.
Thank you, Gabber, and thank you everyone again for joining us this year at GTC 2021. My name is Michael Johnson. I'm a vertical key account manager here at Advantech for Eye Healthcare in the US. And today, I will be going over 3 main use cases where we are seeing advances with AI. I will also go over some pain points that we are coming across in the market and show you how Advantech is helping our customers overcome them. And finally, I will reveal the Nvidia and Advantech eye healthcare solutions that are powering artificial intelligence in healthcare. Nvidia and Advantech are seeing powerful developments with artificial intelligence across three main categories of healthcare. These are 3D rendering, image enhancements, and image and video diagnostics. With 3D rendering, we're seeing an impact on intraoral scanning with increased speeds and smoothness of 3D renderings, creating truer and finer 3D images, which help optimize the visualization of teeth and gums for better patient care, diagnosis, and treatment. Just consider how much these enhancements of visualization impact the patient experience by helping build trust between patients and dental practitioners. Patients being able to witness firsthand what is taking place during examination and the reason for their diagnosis and treatment. And also, for dental practitioners, consider how much these enhancements can increase the speed and accuracy of diagnosis and treatment. And on top of this, the increased accuracy of AI analytics for detection and classification of things like tooth anomalies or impact detection or impacted tooth counting, and even consider detection and classification of root canal numbers of third molar teeth. The enabling power of AI that the future holds for the field of dentistry is extremely exciting. But back to the topic of scanning. We're seeing impacts across all areas of scanning with the image enhancements of AI. CT scanning, improvements with MRI, X-ray, mammograph, ultrasound, and specifically with CT scanning, AI is delivering further reductions in patient radiation dose through the automation and optimization of data acquisition processes of things like patient positioning and parameter settings. And most notably, the optimization of image reconstruction parameters, advanced reconstruction algorithms, and image denoising methods to dramatically improve several aspects of image quality, and especially in reducing image noise and enabling the use of lower radiation doses for data acquisition. And lastly, the use of these AI-based methods, including methods to automatically segment organs or detect and characterize pathology, are being translated out of the research environment and into clinical practice. So this is being done right now. And this is bringing automation, increased sensitivity, and new clinical applications to patient care, ultimately increasing the benefit to the patient, meaning we see an increased clinical benefit and decreased patient risk, not only by reducing radiation dose, but also by reducing the likelihood of errors in the performance and interpretation of medically justified CT examinations. We're also seeing incredible achievements in endoscopy through AI-assisted image and video diagnostics. EGC, early gastrointestinal cancer diagnosis, is extremely critical for the full recovery of a patient. If diagnosed early, the patient has an 80 to 100% chance of recovery. With late diagnosis, the patient's recovery is lowered to 20 to 30%. Well, AI-assisted endoscopy enables EGC diagnosis by identifying anomalies in real time, helping prevent experts from making mistakes and helping them avoid carelessness during surgery, and overall, helping surgeons and practitioners maintain accurate and consistent procedures. And just to kind of reiterate and consider more broadly, in the operating room, we're seeing huge advancements in automation with enhancements of OR utilization and efficiency through workflow optimization. With surgery analytics, surgeons are able to extract and annotate key moments during surgical procedures to gain valuable insights that not only help streamline surgery, but also increase the accuracy and effectiveness, supporting surgeons to avoid mistakes. And another development, which I find pretty interesting, is with surgeons' use of medical displays during surgery. If a surgeon needs to manually scan through images or video, surgeons may not be able to touch displays because of contamination concerns. But with contactless control, surgeons can control and navigate medical images in operating rooms via speech and/or hand gestures. And so now, before we get into the integrated NVIDIA Advantech solutions, I wanted to touch on some of the pain points we are coming across and highlight how Advantech can help resolve them. The first is longevity. Some customers use consumer GPUs, which have a life cycle of only 12 to 18 months. The same GPUs that are used massively in gaming and the mining of cryptocurrencies. And so what is happening is customers end up fighting over the allocation of these consumer GPUs. And while Advantech, iHealthcare leverages Nvidia enterprise GPUs, which offer a life cycle of 3 years, which we can extend for special programs. And somewhat related is that there are only online forums to support consumer GPUs. You can leverage Advantech as a direct channel for NVIDIA tech support. And it should also be noted that NVIDIA Clara SDKs are fully validated on Advantech USM devices and NVIDIA enterprise GPU cards. And so our customers are able to leverage Advantech to help reduce software efforts and development time to get to market faster and more efficiently. And also related to getting to market faster, customers spend 10 to 12 weeks, finances, and resources to have an entire system certified by labs. Again, you can leverage Advantech. We offer medically certified solutions. For example, our USM series PC integrated with NVIDIA enterprise GPUs as standard SKUs. You can leverage these to help reduce your time to market and development costs. And so overall, the Advantech advantage is that we help customers avoid unnecessary efforts and help them relieve safety and reliability concerns by integrating our solution into your final medical device equipment. And so now we come to the NVIDIA Advantech iHealthcare solutions. First, let's start with our USM series medical grade computers, capable of running all AI workloads and optimized for edge inferencing. It is equipped with RTX solutions, including the new A6000 with its nearly 11,000 CUDA cores and 48 gigabytes of GPU memory. The USM family has an IoT gateway, the USM 110, which doesn't really require medical certification, as it's generally used by hospital IT as a clinical media player or real-time location service gateway. It does not run a GPU. However, the USM 501 and USM 501L do require medical certification, as they are intended for the OR and for diagnosis and treatment applications. On the far right is the USM 501L. The L stands for light, as it is smaller, has less I/O, can run up to 250 watts of power, and is therefore only capable of running GPUs that have a lower power draw. This device can be used in operating rooms or for applications like endoscopy and radiology. Our accelerated USM 501, however, is twice as powerful and ready for edge inferencing and for real-time analytics for diagnosis and treatment. It is compatible with RTX GPUs, as powerful as the RTX A6000. It is being leveraged in applications such as radiology, surgical navigation, all these things you see here, video management, and all the different types of scanning applications I mentioned earlier. It has an internal blower, can support several GPUs of 300 plus watts of power consumption. It's flexible. You can add on different types of cards, capture cards or FPGA cards, and it can run multiple operating systems. And now I'm really excited to announce to you our upcoming POC8 series all-in-one AI-powered medical grade PC display. It runs an Intel Core i7 with 8 cores. It can power AI with the MXM Nvidia T1000 or the RTX 3000. It has an industrial grade SSD and a Wi-Fi and Bluetooth module. And as a medical grade device, it is fully certified and is critical EMC EMR compliant. This device is a high performance computing system for 3D and 2D rendering, and is powerful enough to run AI surgery analytics. It contains a gesture control module. This device has a 3 to 5 year lifetime. It is an IPS type image solution with high brightness, which we feel is the best type of image solution for these types of applications, with a wide viewing angle. And with one of our medically certified battery powered cards, you can have uninterruptible power supply. It has various I/O combinations with multiple USB ports, HDMI, and more. It has an IP65 certified cover for easy sanitation or disinfection, and can be mounted on a PC holder or a customized mounting system on a wall or via one of our adjustable arms accessories. I included the black version here just to show you that we have both white and black options. They both have a touch panel, hard plastic front and back covers, a speaker on the bottom, vents on the back, a sheet metal I/O bracket. You can see it has several USB ports, Ethernet and HDMI, and a standard spec VESA mounting system of 100 by 100 millimeters or 75 by 75 millimeters. And with that, I conclude our presentation for today. Thank you for everyone for joining. If you have any questions or would like to understand the various ways that we can partner, please reach out to either Gabor or I through the contact information displayed on this last slide. Thanks again and have a wonderful day.